Explain to them that that your child, you, yourself, whoever, has this rare genetic disease. Explain what it is that affects the teeth. They've probably never heard of it. Explain that it's a medical condition and see what they can do to help you. A lot of times they're a key in this whole process is to get your employer and your HR department on your side. So again, keep going through the process. Don't give up. So the next step is pre-authorize. So when you know what kind of treatment is going to need to be done, whether it be dentures, bridges, dental implants, have your care provider submit that to your medical insurance. And again, medical, always medical. Submit it to your medical insurance and then wait for them to deny you because that's really what is going to happen. So when they deny you, they will deny you in writing. The insurance companies have to send you their explanation of benefits, and on that it will tell you why these services are denied. That's what is very important, is why the services are denied, because then you know what to start the appeal with. So then you have your first appeal. I tell families, only appeal what you're denied. So if they come and say that ED is cosmetic or that teeth are cosmetic, then give them information as to why it's not cosmetic. But if they say it's not a covered benefit, don't tell them anything about ED not being cosmetic. Make this personalized for your case, and talk about what could also be affected if this isn't covered. Nutrition issues, speech issues, what areas might they have to pay if they don't pay for teeth. Then wait for your denial again, because you're just at that first appeal. Now, at that first appeal, actually even with the pre-authorization, you're submitting it to someone in the insurance company that's basically at the bottom of that ladder. So they pop it in the computer said it's denied, it generates a form letter to you, and that's what you start with. So you get to your first appeal. You're just going to somebody that's one more ring up on that ladder who really does not have any authority to override any of this. So at this point, don't get worried. You know it's going to be denied. You know it's going to be denied until that very final appeal. So when you have that second appeal, if you want to, you can submit the exact same stuff because different people are going to be looking over it and reviewing it. So then you wait for that denial again, and then typically you have your final appeal. Now this is what is the important appeal. The final appeal is usually in person or over the phone. If at all possible, if you can go in person, I always tell families to do that. If not, over the phone works fine too. But you have to appeal to their emotions. You have to appeal to their medical director and work on this to get them to cover it. So at that point, if you still get denied and you believe that your insurance policy, you should be covered, then you can contact your state insurance commissioner. Their job is to look over the policy and make sure that the insurance company actually followed what the policy says. And I have phone numbers and websites and email, some even emails for every state's insurance commissioner, so you can contact me if you need that. If you're still not covered and you think you should, you can contact an attorney to see what they can do to help you, although that's not been as successful as we don't kind of keep track on that to know how successful that would be. It has been a lot more successful if you contact the media and give them your plight, and we would be happy to help you with all that. So when the process is over and you do get coverage, please call us so we can celebrate with you. We're here to help you every step of the way. When you're ready to say, I'm not doing this anymore, I'm giving up, we're here to say, come on, keep going. There's not much left to go. It'll all be over soon. So, Beth, do you want to talk about your final appeal that you did with your kids when they were little? Beth, are you still there? Did we lose her?
Can you hear me?
Beth?
Can you hear me?
Now I can hear you.
Okay. I was trying to star 6 and I got confused.
Sorry.
When the kids, when Nolan was, I think 3 is when we got our first set of dentures for him. And I submitted it right away to the insurance company because I wanted to start that paper trail, and I knew they were going to deny it. But we continued with the process. And they did deny it, and then I went the second step, and they denied that. And then we had a third step, and they denied that. and then I appealed. And I knew they were going to deny it, so I just felt like every time they denied it, it just gave me more time to get my paperwork in order and kind of learn the process. But how I first started doing my research was, like Melinda said, know your policy, know what it says, and also contact your state's insurance commission, because they are helpful. And I use them right in the beginning because they have an ombudsman that they, in Massachusetts anyway, it's a person who is kind of like a, almost like a liaison between the customer and the health insurance company. So they went back and forth. So I didn't have to directly contact my health insurance company for everything, because they would try to find out information for me, and they actually tried to negotiate with my insurance company a little bit. The other thing that I did, I wanted to see if in Massachusetts, if we had a regulation that was, there that could help me. And so I just want to tell you all this. This is, instead of you looking into the laws, you can call your law library, because usually every county has a law library. And the law librarians are very helpful in most cases, and they will actually help you search to see if there is a regulation there for you to use. But anyway, so I did all that stuff, and then I got my packet together. And, as I told Melinda, the interesting thing is they kept denying, saying that it was, they don't take care of, your oral needs unless you have sound teeth and you lose them. But they kept saying something about failure to thrive. And, and I don't have the letter in front of me, but they refer to that all the time. No, we're going to deny you now unless there's failure to thrive, or I could share the wording with anybody who's interested. But when we went to the hearing, I thought, well, you know what? They're telling me they want me to say that Nolan has failure to thrive. And they were like giving me the language to use, so I actually dressed him up to look like he was, not feeling too good. And he, was very fair anyway, and I dressed him in like pea green, and he's thin, and so we put some tight pea green clothes on him. And he went to the to the hearing with me, and he didn't look all that healthy. So they interviewed us. There was a whole group of them, all different, doctors, dentists, there was a psychologist, and then people who worked for, it was Tufts Health Insurance. And they sat and they just talked to us for like a half an hour. And they asked Nolan about his dentures, and, they said, Nolan, do you like your dentures? He goes, no, I hate them. And I'm thinking, that just went against us. But he was just being honest. Anyway, to make a long story short, we won. I think they just needed to see us. How can you deny a child his first set of teeth, or any teeth? And we got a letter right after that saying that we were, that they're going to cover it. So I guess, like Melinda's saying, I'm going to say the same thing. Keep going. Keep going, because if you put the time in, you'll win. And I can share anything with anybody. So, again, if you want to contact me, my appeal is very old, so I wouldn't send you what I used because things have changed, but I can certainly help you try to find what you need. But that packet that Melinda put together is awesome. So that's a great place to start.
So have you done anything about trying to get implants since your kids are getting to be teenage years? Are you going to be working on that?
Yeah, that's what we're doing right now. Mm-hmm. Yep, because we're going to see somebody at Children's for implants. So, that's going to be, I'll share all that with you, too. But I know, I don't know if they'll speak now, but I know Melinda probably will call on a few people who have found success, or know stories of some families who have gotten their implants paid for. But I just want to say there was another family in town who was denied by their insurance company. I think it was Blue Cross Blue Shield, and they were going for implants. And she brought the press in, and they did a story, and Blue Cross and Blue Shield pay for everything. So, it may be a long, hard road, but it's worth it.
Well, I have a question because my daughter only has 6 of her permanent teeth missing, so it's not like she needs full dentures, but she has a really bad underbite and, the spacing and everything like that.
Yeah, I don't know. I'll have Belinda address that one because, my kids only have a couple of teeth, so that's my experience is with that.
Sure, and we'll get to all of that. And for right now, if we can hold questions till the end, just so we can get through some of this other stuff, because there's so many on there on the call. And like I said, if you don't get your question answered, please just call me, and I'll help you individually. But we have had lots of families who've gotten their dental implants covered. But we've had families that it's much better if you try to start with the dentures, to try to start with the very first thing. Or if you don't need dentures, start with with surgery for the jaw, or start with orthodontia work if you've got to get all of this done ready for implants. Anything that is ED related. Now, if you've got a normal cleaning to be done, a normal checkup, do not submit that to your medical insurance. If you would be doing this for your child if they did not have ED, then you should still have to cover that yourself or submit that to your dental insurance. But if it's something extra that's happening because of the ED, that's when you submit it to your medical insurance. We've had families be denied on implants because they have never submitted a claim for dentures. And insurance companies have said, try dentures. Or insurance companies have said, you know what, we've never had a claim for dentures. Why are anything else? Why is this now a medical condition? So that's why I say start early. Now, if you haven't done it already, there's a possibility to get it covered. It's just much better if you've got little ones to start with the very first time.
And you're also setting precedent, too. Once you do that, the health insurance company is saying, okay, they do have a congenital, oral defect or whatever. So it's just setting the stage.
Correct. So any denials you get, make sure that that's exactly what your policy states. I was working with a guy from Georgia who was trying to get dental implants covered, and he kept being denied. And at this point, I don't remember what it was based on, but he kept saying, I've read my policy book. I don't see that anywhere, that's not a covered benefit. And he kept looking, and they were waffling, and he ended up going to them, and he was saying, and he actually had an attorney friend who went with him to the final appeal and said, you show me in his book where it says this is not covered, where you keep quoting this from. And they had to admit at their final appeal that there was no place at all that was like that. So make sure that the denials are indeed in your policy language. Follow their process. Like I said, if they say you need to try dentures first, try dentures first. If they say you have to do 2 appeals before a final appeal, do 2 appeals. If they want you to do 3 appeals, do 3 appeals. Whatever their process is, you need to follow it. You need to be nice to them. You want them to be your friend. You want them to, try to get someone on your side who will help work for you. So words not to use. Don't use the word cosmetic. Never use the word cosmetic when you're talking about teeth and ectodermal dysplasia. Another word that is really difficult not to use in your appeals, but try not to use, is the word dentist. If you can use the word care provider, or if you can just say Dr. King instead of, my dentist, Dr. King, the more that is medical related, the better chances you have. Recommend that you get letters of support from your dentist, but also from your physician. That is the most important one, is a letter from your medical care provider that says that you have ectodermal dysplasia, that multiple missing teeth or teeth problems are part of this, and that dental implants or whatever your treatment is the proposed medical treatment for this.
And I also got a letter from my the genetic counselor as well, explaining what ectodermal dysplasia was.
And that's great. If you have a genetic diagnosis and you have that, that's great. A lot of people don't have those diagnoses yet, so you can just say, you can have your medical professional, your physician write that for you. A couple of things that people always ask me is, do you have a claim for Blue Cross Blue Shield in Texas? Because I have them and they need to pay. Years ago, that kind of was the case. The policies were kind of written by state. The states had the same policy. Now, every single policy is written differently. So I might have Blue Cross Blue Shield, and my next-door neighbor might also have Blue Cross Blue Shield. but our policies are completely different. So just because they're going to cover my child's dental implants does not mean that they have to cover my next-door neighbor's dental implants, because they might have their policies that are not in mine. So keep that in mind. It is helpful to show that insurance companies do pay for this, and that a lot of them have. So it's good to send them the list of that. We have documentation that all of these have paid for. But you can't say, this one paid for it. You have to pay for me too. So I'm going to start with a few of the questions that were submitted before the conference call, and hopefully they'll be able to give you some more tips and ideas, and answer some of your questions yourself. But the first one is, can we use our choice of dentist since ours has already made 2 partials? We recently signed up with Kaiser. Have others had luck with paying for dentures? Again, like I said, your Kaiser might be different than your next-door neighbor's Kaiser. So that doesn't necessarily mean, but it's important to use the dentist on your plan. And there's a couple of reasons for that. And there's typically not a lot of dentists on your plan, so then you've got to fight them for someone out of network. But find out who the dentist is that are on your medical plan, and that's who you need to go see for an initial consultation. That might be who you need to see. Reimbursement rates from insurance, especially for dental professionals, are very, very low. So if it might be $2,000 for the implant, your insurance company might only pay them $300. But if they're on the plan, they have signed a contract with that insurance company that they will accept $300 for that dental implant. So then you only have to pay whatever your deductible is, and then whatever your plan is. So if you've got a $1,000 deductible and then a 90/10 plan, you would pay the first $1,000, then you would only pay 10% of that bill. So you're much better off using someone in your plan. A lot of times if you use someone outside of your plan, insurance companies only pay 50%, and if it's someone outside of your plan, they don't have to accept that $300. They can charge the $2,000, and your insurance company is still only going to give them half of those $300. They're only going to give you $150, and you're going to be responsible for paying for the rest. That's why it's very important to use someone in your plan. Call them, because there might not be anybody at all in your plan, but then get them to say that you can go to someone outside of the plan for the same benefits. Next question. Why does the medical insurance companies not want to accept the dental issues or the dental-related issues as a medical problem? What I'm finding is most companies are not denying based on medical necessity. They are denying based on policy language and saying it is not a covered benefit. So if they're saying that it's not medically necessary, it's much easier to fight than if they're saying that it is not a covered benefit.
This is Beth. That's, again, I'm just going to reinforce what Melinda had said. Read your policy and use that language against them. That's what I did. I mean, I used their own words and also their mission statement. That's really powerful. In my insurance policy, it did say they don't cover dentures, but it also but that's the only thing they said about dentures. It just said they didn't cover them, but they did say that they covered congenital birth defects, and so I use that language. So that's really it's a good point.
Sure. Next question. My dental representative tells me this is a medical condition, and the medical representative tells me this is a dental condition. Both pass me off to each other until I'm finally disconnected. So I've been told since this is a genetic condition, coverage does not apply, as well as this is cosmetic and not necessary. There's a couple of things to do in this incident. First of all, talk to your HR department and see if they can help you with this process. If that's not something that you can do, when you call again, demand to talk to a supervisor. Talk to somebody and get them and have them submit something to you in writing as to why it would be considered a dental condition or why it would be considered a medical condition, so that that's something that you can fight from them. If it's not in writing and you don't have it in hand, I always say it's not true. So until you have that piece of paper in writing, don't believe that it's true. Melinda, it is 7:30, just to let you know. Okay, great. My son has ED, and we see a regular pediatric dentist every six months. He just does an exam, no cleaning. How would I file this with my medical to get reimbursement? My suggestion is do not file this with your medical. When you file things like this with your medical, it's much less likely that they will pay. So, like I said, if your non-ED child has to go for a checkup twice a year, your ED child would have to go for a checkup twice a year, and that's something that you can file with your dental. Another question. My daughter is missing most of her permanent teeth. She's 7, so right now things are okay. I know within the next couple of years we'll have to start working on her smile. We had genetic testing and none of them confirmed ED. Do I need to get a confirmed diagnosis? The answer is no. You start the fight the exact same way. Your medical professional can say that she has ectodermal dysplasia, and your insurance company typically does not require that you have a genetic diagnosis. The only way they would is if, in their appeals, they say that they will only cover it with a genetic diagnosis. Our son's medical insurance is a local HMO. Any suggestions on how to approach them? You approach them the exact same way. You have to find out who is in their plan that you can see with an HMO. And so all the other tips are exactly the same. You treat them the same way. My daughter is 2, and she will have her first dental work prior to entering kindergarten. Right now we pay everything out of pocket, we have no dental insurance, and our health insurance won't cover any of her dental appointments. When is the time to try to get insurance to cover treatment? Now before she has the procedures or after? I always tell families to get this coverage when you are working on any ED-related care. So on this little girl, she's 2, when it's time to get her a bridge made, to get her removable dentures, that's when it's time to start the insurance process. Start the pre-approval 5 to 6 months before you're going to do it. Have your dentist write down what they're going to do and work on it then. That way you know up front what's going to be covered and what's not going to be covered.
I have a comment. This is Beth. When I first started fighting my insurance company, I saved all my receipts from the dentist, and I had, I don't know, I think probably it was over a year that he had gotten the dentures, and I submitted those, and they reimbursed me for those. So they went back a year. That's everybody save all their receipts.
Sure, and you have up to a year to submit your claims to your insurance companies. So if you have work done that was done prior, then you have 1 year to submit that. Here's one. Our orthodontist wants to start work this summer. Should we pay her bills up front? I don't think they'll submit for us, and then send them to our medical insurance company. If you plan on doing this work regardless, and you're going to do whatever it takes to pay for this, then pay your bills up front, and you do your own submitting. If you cannot do this unless the insurance company puts in their part, then start the pre-approval process 5 to 6 months before you're doing this, so that you know what is going to be covered and what hasn't, so that you know if there's other alternatives or not. A lot of dentist offices will, there's certain dentist offices that will not submit claims, but a lot of them will fill out the paperwork for you and let you submit it on your own. Ask them if they'd be willing to do that. Or if you're savvy enough, you can submit everything yourself. Usually your insurance company website has all of the forms that you can download and steps to the process for you to submit it all on your own. I read with great interest that our insurance we currently have was listed as one of those that granted appeals. Of course, ours is federal, so I don't know if we would expect the same. As federal and state employees, my husband and I have been told that our insurance companies do not have to abide by state insurance regulations. The insurance manual says there is coverage for congenital birth defects with the exception of dental implants. Is one just stuck at that point? There's a couple of things you can do in this situation. Yes, if they're a federal insurance, they do not have to follow the state mandates. So are you stuck? You can go ahead and fight and try to get them to make an exception for the dental implants and figure out, do they cover birth defects? What else do they cover? Or think about, are there other treatment options? Are dental implants the only option you have? Would they cover Would they cover a bridge? Would they cover dentures for now? What would they cover to get teeth in that mouth and to make it worth? It could be that there's always more than one option when it comes to dental work, and this could be the case that if you can't afford to pay everything out of pocket, the dental implants, it might not be the right time for that, that traditional dentures might work just fine, and that you would be able to get your insurance company to pay for that. So always know that there's more than one treatment option. A lot of times the dentist wants you to do the top option, whatever it is, the $100,000 option, when maybe the $5,000 option might work just as well for a while. My insurance company approved me over the phone, but they would not approve the submitted claim. Like I said before, if you don't have it in writing, it's not true. If they approve you over the phone, ask them to send you a letter in writing that states that this would be covered. Most of the time, you cannot get an approval or denial. Anyway, you can call and ask if it's going to be approved, denied. They say, yes, we think it is, or no, we don't think it is. Until somebody actually submits a claim, that's when you know for sure it's denied or approved. So always get things in writing. Two, if you're talking to them and they say, yes, this is the case, write down who you're talking to. Write down what time you talked. Write down what they said. And a lot of times I say, grab a piece of paper and pen, write a letter saying, I just talked to you about this. I want, if this is not the case, please contact me. So at least you have something in writing from them that says, no, this is not the case. This isn't the way that we talked about this. Like I said, this is another one. How to make sure the insurance company takes your claim as a medical claim, since dental claims are limited. That's a really good point. Dental claims a lot of times have a $2,000 a year max. When you're looking at $75,000, that's really not going to do you a whole lot of good. Where your medical claims, you pay your deductible and then whatever percentage is in your insurance policy. So always, always, always go to your medical insurance. Now, I will add to that the only time I say don't do that is when you've gone through your entire appeals process and your medical insurance will not cover it, but you have dental insurance and it says that they will cover crowns, bridges, dentures, all that kind of stuff. Use what insurance you have. If your medical insurance will not cover it, that's when you submit it to dental, because there's no reason not to use the insurance that you're paying for. A lot of these questions are the exact same thing.
I have one little question.
Sure.
If, yeah, I just want to know, is we're not on the same insurance as when, my son's 8 now, so when he first got his first dentures, we're not on that same insurance now, and my question is, he's going to be due soon, in which case, when we file and they tell us it's a pre-existing, like, would it be like the same fight of a process? You know what I mean?
Good question. Is the insurance company a group plan?
Yeah.
If it is through a group plan, they cannot deny you based on a pre-existing condition.
Okay.
But I will tell you that you set a precedence with your first insurance company that they paid for this. You have to start the process all over again now that you have a new insurance company.
So, okay.
So you're back at square one to do this. So good luck, and I'll help you through the way. But so a lot of families switch insurance companies every year or every 2 years. If you set the precedent with your insurance company that they're going to pay for dentures, and you don't have to switch insurance companies, I definitely wouldn't switch, because you've already done the fight once, and you don't want to have to do the fight for every single set of dentures.
Yeah, but now it's a totally new company. It's a totally different company, so they're all done their own.
Sure.
Kind of thing.
You're starting back on square one now with that.
Okay.
Can I ask you something on that?
Sure.
When a company switches themselves to another company, can you have the power to take what was covered and bring it over as proof to show them? Does that hold true?
No, it does not hold true.
They do not have to cover it?
They do not have to cover it, and especially, correct, they would not have to cover what the old company covered, because they're just changing their policy.
And then are you going to touch upon medical codes necessary when submitting dental work?
I can do that. The medical code, it's all in the dental guide, or the insurance packet that I mailed you, or that I emailed you all. But it's 757.31 is the ectodermal dysplasia code.
Can you repeat that, please?
Yes, 757.31. And like I said, this is all written out in the insurance packet that I emailed to everyone. So if you did not get that, please let me know, and I can make sure that we can email it to you or send you a hard copy on that.
Okay. I have a couple questions. One is, my son is on my dental insurance, but on my husband's health insurance. So how do you handle that?
You submit it to your medical insurance. Always, always, always medical insurance.
Okay. All right. Now, he's also going to be 18 at the end of the month. We paid for all the braces because my insurance would pay for some of that, and he's missing 10 permanent teeth. So now we're getting ready. The braces have come off. They've done the cephalgram to make sure he's quit growing. So now we're ready for the implants. So I should go, the next step should be go to the prosthodontist and get a treatment plan and then submit that to the medical insurance?
That is absolutely correct. That's exactly what you do.
All right, then on your 25 steps to successful insurance battle, number 3, how do you find out if there is a state insurance law or mandate on your side? How do you find that out?
You can talk to your insurance commissioner. This is also, all of the insurance laws that we are aware of are in the insurance packet that I emailed everyone. New York has got the most comprehensive mandate. Virginia has got a mandate. Virginia, though, you have to have been born in Virginia, never moved outside of Virginia, and always had coverage of insurance while you lived in Virginia to be covered. Wisconsin has got a law that is for children, and then there is kind of a TMJ law that has worked for some families with ectodermal dysplasia out of Georgia. So those are the ones that we are aware of. If anybody knows of any others, please let me know so that we can update them and help other families.
So where in this packet did you send? It doesn't have page numbers, so what heading is it under?
Probably the insurance laws are on the very back of the packet, I believe.
Okay, and the same for trying to figure out who your state insurance commissioner is?
Insurance
it's really
commissioner,
easy.
You can do a web search on that, or you can contact me and I can give you that information. We don't. It's pretty extensive, and they changed those numbers, so I don't have that in a written format.
Yeah, because the state insurance that's in the back is for various states, but I live in Iowa, and Iowa's not listed. Okay.
You do not have any insurance laws on your side. I can tell you that.
All right, thank you.
But what you do have on your side is a great dental treatment center at the University of Iowa. And that's something for families to think about, too, is they're doing their treatment is a lot of times there's a lower cost alternative that you can go to. And Mary Fate in our office can help you with the dental treatment centers. But we can try to find a place for you to go to get this done at a reduced cost that will really help out your pocketbook. So if you've got questions on that, let me know and I can forward those on to Mary, or you can just contact Mary Fate.
Hi, this is Denise from Iowa again, and yes, I am working with Dr. Clark Stanford at the University of Iowa, who I believe is on the National ED Board. He's a prosthodontist at the university, and be happy to pass along his phone number to anybody that would need that.
And we have that information, too. He's one of the best. You're in very good hands with Dr. Stanford.
Okay, good. Thank you.
Hi, this is Gloria from Connecticut.
Hello.
Okay.
And I just want to comment about working with universities to get top care but lower cost care. Jennifer, our daughter, lives in New York, works in New York, and is going through implants at NYU, New York University. The problem with working with a university is high turnover of doctors, student doctors. You're assigned to a top surgeon or a faculty member who oversees everything, but then you have a student who is specializing in implants, work with you. And Jennifer has been going through this for 4.5 years and is still a long way from being finished, because every time you turn around, it's a new student being assigned, and everybody has a new opinion.
And that's one of the things with our dental treatment centers we are working on. At the moment, NYU is not one of our dental treatment centers, but it is a great place to go to have work done. But our dental treatment centers, we really work hard on them making a commitment to the patient to get the work done and not taking the 4-year process.
Yeah, like a faculty oversees doing the work.
So that's, like I said, Mary Faye can give you some more. I just wanted to throw that out there as another option to get work done at a reasonable cost. What other questions do people have?
This is Nancy from Maryland. I wanted to just ask if you are unable to get the ectodermal dysplasia code, but your child still has, in my case, my son has 18 missing permanent teeth, doesn't have any of the more visible symptoms of ectodermal dysplasia. Can you still file under genetic congenital anomalies then?
You can, and this code is kind of a congenital anomaly code, so you may be able to use the same code.
And you just need your doctor, your child's doctor, to put something in writing. I mean, is that, to say that he has, I mean, if he's missing 8 teeth, he has a congenital abnormality.
Right, and that's what's more important, is that it's a congenital, I can't talk anymore, defect.
Because it's from birth, so it's, yeah.
I guess I was just wondering if those appeals have been any less successful because of it not having, the name,
No.
very specific. No? Okay.
You just
The
got to
appeals that
hang
are
in there.
successful are those who fight to the very end.
Very end.
Okay.
So I have a question about getting insurance. So my son, basically we had pretty good luck getting dentures covered through him. We both had dental coverage, and our dentists work with us. So, we've got dentures through the years, but he has no bottom teeth in the front. And, the only way he can hold a denture down is with his tongue because he has no gum ridge. So, I mean, he's really a candidate for implants. But we're covered by Kaiser in California. So I doubt that they have prosthodontics that are Kaiser?
Well, you
And
have
would
to
they be
ask
very
them.
good?
If they don't, then you have to ask them, who do you send me to?
Okay, so you just kind of approach it from,
You
I
approach it
need
saying,
treatment
I need to know
from a
who's on your-
medical standpoint. Who can I have him
see?
see? Okay.
And that's happening with my youngest son, or that has happened with my youngest son. He has no bottom teeth.
Right.
And he's never been successful with a bottom denture.
Right.
And even we went to UConn to talk to them there, and they looked at him and they said, well, he can't wear a bottom denture.
Right.
I mean, it's impossible.
Right.
So we just had his primary care provider and that dentist write that it's medically necessary for him to get dental implants because he cannot wear a denture. And so we're building that, that case against a case for dentures. Case for implants.
So I guess what my question is, but I also have the option of getting other medical coverage. So would I be better off trying to get a plan that's a little more generous than an HMO, that's a strict HMO like Kaiser, and spend the money to put him on, during an open enrollment, to put him on more of a PPO type plan where I'd have more choices of providers? Because this is a kind of specialized thing. You don't want just anyone.
See, out here in Massachusetts, I didn't do what Melinda is suggesting to do because I did this before, a long time ago.
Right.
So we just used our own dentist. He wasn't on the healthcare plan at all.
Right. Right.
Because he was somebody who was willing to work with a 3-year-old. And my insurance company, and it's just my insurance company, like Melinda says, everyone is different.
Right.
But my insurance company, that didn't matter to them who we used. They were just fighting us because they said they weren't going to cover it. With dental implants, though, we are going with somebody who's in our network because this is an operation. So we're going with Children's Hospital in Boston, but they're on Tufts plan. So, yeah.
So Children's Hospital handles kids who are 15, 16, 17?
Yep.
Most of the dental hospitals are going to cover kids that are older because I have a 19-year-old, and she's getting covered down at Baylor in Dallas.
Sure, and you can look at the policies. If you have a chance to get the insurance policy manuals before you pick your policy,
Yeah, maybe just check.
look through them. See if they've got direct exclusions that say will not cover dental implants under any circumstance, or see if they say they do cover birth defects. What do they and what they don't they cover, and really do your research who you think would be the best one. And it could be that Kaiser might be the best one. It could be that they really, at this point, if they don't have a dentist person, they wouldn't care who you would see.
Yeah, that you could go to
But you need to check out all those options.
Okay, and I do see you have Kaiser California listed on your thing, but does that mean they pay dentures or implants, or
you know what?
Find that out after the call?
It doesn't really. It means that they have covered dental work under a medical claim.
Okay.
Is what it means. So. So yeah, that's fine. And, you know, one of the things we did not talk about, but if you really want this to happen for you in your state, and that you don't have to fight your insurance every single time that you submit a claim, every time you get new dentures, every time your company changes policies, you have to have a state law in your state that makes this happen. And I can tell you that the NFED cannot make that state law happen, because we are not constituents in your state. So if that's something that you're interested in working with your legislation, with your senators, with your representatives to try to do something in your state, we've got some information that can help you with that too. Beth is working right now in the state of Massachusetts and would love any help that she could get to get her law covered so that families in Massachusetts are covered. This is a very great, exciting year. We have a federal senator who's kind of taken up the cause and is pulling whatever strings he has in the state of Massachusetts to help out with this plight. So, you know, we're very hopeful that this will be the year to get it done. And that's, you know, way too much information to get into on this phone call, but if this is something you're interested in and spearheading, please contact me, and Beth and I can help you with the steps that would need to be done to do that for your state.
This is Denise from Iowa again. My son is missing, as I said, 10 permanent teeth, but the teeth that he has are a terrible color and terrible shape, and it's the color mainly because when he was a very young child, he had so many ear infections and has had multiple ear surgeries and tympanic surgeries, and all the antibiotics discolored his teeth, his permanent teeth. So in a sense, we do have to have some cosmetic work done, but it's a result of the genetic disorder. So has anyone had any luck with I know we're not supposed to use the word cosmetic, but the cosmetic part of it, because it was caused by the ear infections, that just as the station tube's not formed correctly?
This is Beth. We had gold copings put on Philip's front two teeth because they were unhealthy, and we wanted to save them for, you know, dental implants or save the bone. And they covered that. And we didn't, you know, we just said it was for the health of the teeth. So we didn't use the word cosmetic. You don't have to use that word. His teeth are unhealthy right now. So it's for the health of the teeth.
And that might be harder to get covered, but it's always worth submitting it.
Yeah.
You never know what they're going to cover and what they're not going to cover.
If it's related to the birth defect, then it's how you write it up too. Again, look at your policy and use the words, you know, that they give you right there to use.
You know, one thing we have noticed quite often is that if your insurance company says yes, they'll cover your implants, that does not mean that they will cover the prosthetics that go on top of the implants. It makes no sense to me at all that they would cover, you know, dental rods in the mouth but not cover teeth to put on top of it, because they'll fight and say that the teeth are cosmetic but the implants are medically necessary. So that has happened quite often. So even when you think you're done, if they say that they're going to cover implants, make sure that the prosthetics are part of that pre-authorization that you're asking for too.
We have 5 minutes left on tonight's call.
We've got time for a couple more questions. Anybody have a question?
Yeah, I'm Stacy from Virginia, and I was just interested in what you were saying about certain, the state mandate not covering certain people, and from what you're saying, it sounded like we may be in that boat. But if you're not covered based on the mandate, is there still a way to get it under the policy anyway?
It's possible. You have to still fight your insurance plan, like we've said. And a lot of times you can submit a copy of what the mandate is and say, look, this is, usually covered in Virginia. We would fall under this. Please, why wouldn't you cover us?
Well, I know that the language of the mandate is actually the language in our policy, but even though we've lived in Virginia throughout my pregnancy and the birth of our child, she wasn't actually born in Virginia, and our insurance that we had at the time she was born was out of Connecticut.
I would still try it. Still try it with that mandate and see what happens. I will also tell you that just because there is a mandate doesn't mean that you don't have to go through the fight. In New York, like I said, it's the most comprehensive mandate. People are still denied the first and second time. Even when they submit the mandate to them and say you have to cover this, they're still denied. So make sure that you're ready to take the fight all the way to the end.
Yeah, just as a word, I don't any longer, but I used to practice as an attorney in the insurance field, not in health. But a lot of it is just the bureaucracy of who you're dealing with at your first few contacts with the company.
Sure. Any other questions?
I have a question.
Go ahead.
I have a question. Do most of the parents, are they finding that when your child goes through the dental part that the dentists are wanting to do a bracket from the lower to the upper jaw to realign and reposition the child's mouth?
That would be a treatment question that I'm not sure that we could answer for you.
Okay, no, that's fine. I wasn't sure, so I figured I would just ask, because we've run into that problem, and now we're just kind of stuck. Do we do things?
You know what? Email Mary Faith. She would be able to help you with that.
Okay, thank you.
I have a question. This is Lisa from Ohio. If you have more than one child affected, do you have to do this for both of them, or once you get the first one in, are you...
If they're both under the same insurance, once you get the first one, they should cover the second one.
Okay.
Let me speak to that. Out here, when we fought for Nolan, they told us they were not setting a precedent for Philip and that we would have to go through the process.
But they did that in writing, correct, Beth?
They put that in writing. But they did say that because they were trying to, not bully me, but I mean, they were just giving me, dentures for the next 20 years. And I think they didn't want to give me any more, so they said that. And so the next year I just filed a claim for Philip's dentures, and they paid it.
Great.
Because I wrote in the letter, you've set a precedent, and, blah, 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 and they just paid for it. So I think even if they say they're not going to cover it, just try it.
Okay.
This is Carly in North Dakota, and I was curious if there's a place online where there's a forum or a place where people can post their stories just to kind of network.
It's almost over anyway.
So I'm sorry, you were kind of soft there. Were you asking if there's a place or a forum online where people can post their stories?
Yeah, and kind of network and continue
there we go.
discussions with other parents.
You know what? Through the NFED site at the moment, we don't have something like that, but we do have a site on Facebook. We have a fan page. That if you're a Facebook user, you can get on that, and there's a place to do that through Facebook. So that would be what I would suggest.
Okay, thank you.
I got a weird message from Facebook today that the group name was changed. Is that something?
We have disabled the group name. There are more, the group page, and we are only using the fan page right now because there are more benefits to the fan page. We can get information out to you quicker because we can alert you that we have posted something, or if a family posts something, you can invite and you can send that out. So there's more benefits to using the fan page. So we're no longer using the group page, but we are using the fan page. You know
So
how to
if you were on the group, you need to re-sign up to be on the fan page.
That's correct.
Well, my name is Ron. I'm from Washington, and our insurance has agreed to pay at least part of the implant process. Our son has no permanent teeth whatsoever, and yet it doesn't appear that they will pay at all for the actual crowns to be built on top of those. Is that typical, and is there some way to argue that, or is there some way to try to get the teeth covered?
That is very typical. And you need to find out from them why they are not paying for the crowns.
Okay.
And what their reason is, and see if you can just appeal that and start appealing that. See if they're saying that's cosmetic, because those implants aren't any good without those crowns.
Right.
That is our last question of the evening. It is 8 o'clock, or a minute after. Melinda, do you have any closing thoughts that you'd like to share?
You know, just again, if you've got questions, please contact me. I'm happy to get back to you via email or phone, and you know, we can work through this process so that you too can get the coverage. On a completely different note, Kelly, I'm going to throw a plug in for this. If you have not gone to prescribethenation.com, we need everybody on the call to go to prescribethenation.com and send an e-card to their friends or family. For every e-card that's sent, $5 is donated back to the NFED. So it only takes about 3 minutes, and the Vaseline Skin Fund is making this donation to us. So I just wanted to kind of throw that out there so that we can get more people to help us do our work. That is, you know, 3 minutes of your time to give us $5 really goes a long way.
What's the expiration date of doing that?
That is going through the end of July.
All right, thank you.
So please send multiple cards. We need 10,000 people to do that to get the $50,000 that we would like to get from them. Okay, Kelly, I'll let you wrap up now.
Thank you very much. Later this week, you will receive a survey from me, and I ask that you take the time to complete it, and so that we can evaluate this new program that we've developed, hosting these educational conference calls. This is a very cost-effective way to get information out to all of our families. Not everyone is able to attend or participate in family conferences, so we will be covering various topics throughout the year. We have 2 more calls this year. You can check back at our website for the titles of those calls. And then at the end of the year, we will evaluate to see if we will increase the number of calls for 2010. I hope that you've enjoyed tonight's call. It's been very informational for me. I don't usually handle these calls. I do a quick forward to Melinda, and she takes over from there. So it was educational for me, and I hope it was for you as well. If you have any questions at all, please do not hesitate to contact Melinda or myself, and we'll certainly get answers to you. Hope you all have a wonderful evening, and thank you so much for participating in our second call.
Thank you.
Thank you. Bye.
Thank you.
Explain to them that, explain if